Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report on suspected dentinal microcrackline or caries that is causing apical periodontitis. So patient was basically referred for the scan of lower right side region wherein patient was giving pain on percussion POP positive on the first molar regions. So we took a CBCT of the first molar region and examined the case starting from the occlusal aspect. We saw some findings that were seen, so we'll just hide these lines and go along the long axis of the tooth starting from the mesial aspect of the tooth. So this is the mesial aspect of the tooth. We could see some initial dentinal microcrackline like appearance over here. As we go towards the distal aspect, we notice as we go towards the distal aspect of the tooth, so we could see some kind of radiolucency over here again on the occlusal cusp aspect. So not the cusp, sorry, the occlusal fissure aspect. Similarly, so we just mark the line over here and check on the distal aspect of the tooth. So we could see some kind of radiolucency on the distal aspect of the tooth. We'll just zoom this part of the image to just study the line. So this is the line that was studied. So you can see here there's the dentinal caries, very well evident dentinal caries with fracture of the distal cusp. You can just see it over here. We'll just arrange this, and we can also appreciate some kind of line over here over this side. So this is the dentinal microcrackline like appearance on the distal aspect. We'll just see this along the long axis of the tooth. We can see a similar line on the axial section, all restricted to the crown and not extending to the root. So the tooth can be saved with help of a filling or root canal treatment depending on the extent of the dentinal microcrack line on excavation. Okay, so as you can see, very well evident decay over here. So doing the root canal study of the case, so we can see there are two canals over here when we check the mesial aspect. So mesiobuccal canal and mesiolingual canal that unite to have a single common exit, and similarly a single distal canal that is passing by when studied along the long axis of the tooth. The lamina dura seems to be intact throughout the tooth, but very periapical 1/3 region we can see some kind of initial loss of lamina dura or discontinuity of lamina dura. So as you can see, though there is the boundaries of pedial space appears to be widened, as you can see it over here. Hence we give apical periodontitis also as a differential diagnosis, but it's the start of the periapical pathosis, you can say, as seen on the mesial root as well as on the distal root. Okay, so this was just a quick case on dentinal microcrackline or caries as evident on the lower right side region.